Hello, everybody. I'm Dr. Philip Kannel. I'm talking to the Medical Academy at the New Smyrna Beach High School. Um, your teacher is Mrs. Lindsay Posick, and I'm Dr. Philip Kannel. I have been a practicing physician in the specialty of ear, nose, and throat, head and neck surgery, also known as otolaryngology, head and neck surgery, for the past 38 years. I am also Mrs. Posick's and Mrs. Cox's father. And Mrs. Posick asked me to uh, give a lecture or a talk to you students about the history of medicine. This will be a very brief history of medicine, since medicine has been around since the beginning of time. And we'll kind of just hit some of the high spots. If you have any further questions or want to delve in further, I'm sure there's lots of sources on the internet for this. And any questions that you have will be submitted to me by Mrs. Posick in a written form, and I will respond to those. So, with that being said, let's get started. The medicine has been performed in some manner or another since the beginning of time. Early records show that the Babylonians, Chinese, Egyptians, and Indians, not our indigenous people, however, but the people actually from India, have had a long history of descriptions and treatments of various disease entities, including some surgeries. The Hippocratic Oath was written in the 5th century BC, over a few years. It's widely believed that it was written by a number of people over a few years, and the fact that it survived is amazing in itself. Mrs. Posick will be going over that more with you, reading it and delving into the Hippocratic Oath a little bit more. Now, the university training of physicians really didn't begin until 1220 AD in Italy, particularly in around Salerno, Italy. And indeed, the standardized practice of physicians in the United States didn't really become standardized until the Flexner Report was released in 1910. Abraham Flexner was a researcher, and he was commissioned by the Carnegie Institute to put together some kind of a standardization of medical studies. Which he did. And this was a book-sized landmark report of medical educations. Many of the aspects of the present-day American medical profession stem from this report, which is interesting in the fact that a little over 100 years ago, 110 years ago, the practice of medicine was not standardized, the study of medicine rather, was not standardized, and it was a hodgepodge of various practitioners, medicine men, hocus pocus. It's an amazing landmark report. Prior to the 19th century, a thing called a system of medicine was called humorism, was used to explain the cause of diseases. These humors, which were thought to be made by other various organs in the body, were blood, phlegm, black bile, and yellow bile. These were the vital bodily fluids that were believed to control everything in the human organism. This persisted for hundreds of years until the germ theory came about in about the 1600s. At the time, they had no understanding of bacteria and viruses and really germs. And in fact, after the germ theory became available, it still met with quite a bit of resistance. Sanitation improvements then came with the growth of cities, helped to improve living conditions and reduce the incidence of some diseases, particularly some of the more communicable diseases. Then research facilities in the 20th century helped to spur the developments of the antibiotics, surgical instruments and techniques, along with advances in chemistry, genetics, radiology, and now leads to what we call modern medicine. So we have come a long way, baby. And if you can see in that previous slide, there's a picture of an operating room on the left, and then the right was another operating room, operating theater, they called those, where actually people sat in the stands and watched a surgeon perform surgeries. You can see how sterile and everything the things were back then. So we definitely have come a long way, baby. So although no written records exist today, there can be no doubt that the early practitioners used healing types of plants as well as clays and soils. One of the first substances that were used was actually willow bark that's found in regular willow tree. It has salicylic acid in it, which is a precursor to aspirin. Little did they know, but they knew that it worked to relieve aches and pains and inflammation and fevers. First known dentistry dates to around 7000 BC. Another part of his prehistoric medicine was called trepanning or trephination. That's a drilling of a hole in the skull. And it's been found in skulls dating from 6500 BC. This was done to let the evil spirits out of the head and as treatment for epilepsy, headache, head wounds, and mental disorders. This, you can see from the bottom there, there's pictures of a skull with holes in it where people had actually drilled through there. And then on the right, there's actually a picture of them doing this. There are some skulls that have been found in various prehistoric civilizations that have been recovered with holes in them from Europe, Siberia, China, and the Americas, particularly Central, South America, and some in North America. And this actually persisted until the 1800s. In fact, some skulls have been found that actually have healing around the holes. So this would tell us that these patients actually lived for quite some time after they had a hole drilled in their skull. So when your parents tell you you need another hole, you need that like another hole in the head, that's what they meant. In ancient Mesopotamia, then, the doctors would prescribe magical formulas to be recited as well as medicines. A lot of the medicine, or a lot of the disease entities back then were thought to be from supernatural causes and from other deities, gods, humors. Again, the humorism thing. Around 1050 BC, the Babylonians introduced the practice of diagnosis, prognosis, and physical exam in what was called the Diagnostic Handbook, as well as causation and therapies. Based on the presumed diseases, the treatment was usually bandages, herbs, and creams. Other healers would use animal products, minerals, potions, and enemas, ointments, and poultices. Many could set broken bones, dress wounds, and perform simple surgeries like draining abscesses. The mental illnesses were believed to be caused by specific deities or gods, and sometimes humors, sometimes smells. And some practitioners kept track of the patient's hallucinations, believing that if he saw a dog, he would die. But if he saw a gazelle or an antelope, he would recover. The Egyptians developed a practical use of anatomy and public health and clinical diagnostics, although they mostly dealt with supernatural in their practice of medicine also. They were pretty well advanced at the time. It's called the Edwin Smith Papyrus, which was written about 1600 BC. It's called Edwin Smith for the man that owns it. It's an ancient textbook on surgery. Their medical institutions were called houses of life, and these were established as early as 2200 BC. In ancient Egypt, many of the medications were delivered by enemas, and this is where put a tube up your butt and put the medicine up there. And one of the medical specialists was called the shepherd of the anus. Wouldn't you like to be known as that your specialty? India was home to Sushruta, also called the father of plastic surgery. He described rhinoplasty and various other surgical procedures. He invented surgical instruments and wrote an exhaustive medical book. Some of these pictures that are shown there that he had invented, it's just amazing that he could perform a rhinoplasty, which is basically a nose job, on a person, and just having the rudimentary knowledge of anatomy that he had. It's just really amazing. In China, they also developed a large body of traditional medicine, including many herbs and animal parts. You can see from some of these pictures there, there's one in the lower left, or the top left there. There's some dried snakes, curled snakes right there. Right there, they ground those up into powder and ingested them. The one right next to that, those are turtle shells. There's some also herbs that they used. And the Chinese also invented acupuncture around 200 AD. The chart then on the lower right shows that some of the acupuncture points. So, ancient Greece was the home to Hippocrates, who was considered to be the father of modern medicine. The Hippocratic corpus, or body, corpus means body. It's a collection of about 70 early medical works. It's associated with Hippocrates and his students. Again, these were probably written by multiple people over many, many years. He gave many of the first descriptions of lung disease and was the first documented person to have performed cardiothoracic surgery. Can you imagine that? 400 BC, he's doing surgery on your heart and lungs. He and his followers, though, believed in humorism, again, which is the humors which were produced by various organs in the body and had to be in balance to remain healthy. Those humors were described as blood, phlegm, black bile, and yellow bile. One way to maintain balance was through bloodletting. We'll get into that in a little bit. Other ancient Greeks laid the foundation for the study of anatomy and physiology. They described eye surgery, plastic surgery, methods of stopping bleeding, setting bones, and the use of mandrake as an anesthetic agent. Mandrake is a root of the mandrake plant that is found in many different places in the world. It is known for its hallucinogenic properties. It's a very bitter tasting, and it made a lot of people actually get sick and vomit. But it also had some anesthetic properties, and they experimented with that as an anesthetic agent. Two of the most famous of these Greeks and Romans were Cellus and Galen, and they both laid the foundation of anatomy and modern anatomy and physiology. They weren't always accurate. There was a lot of inconsistencies with that, as you might believe, but they actually started the method. Galen actually performed surgeries on the eye and the brain, surgeries that were not attempted again for almost 2,000 years. He dissected animals to learn about the body, because dissecting a human body was banned by the Greeks and Romans until the Middle Ages. And indeed, some aspiring physicians and surgeons had to resort to grave robbing, body snatching, and murder, just in order so that they could have a body to dissect. Body dissection was allowed, however, in some cases of public execution. Back in the 1800s in Britain, as an aside, they didn't really allow dissection either in Britain at that time, but a thriving black market rose for cadavers and body parts, leading to the creation of the profession of body snatching. And the Burke and Hare murders in 1828 were very famous at the time, and they killed 16 people. These people were murdered and their bodies were sold to anatomists. Some have even proposed that Jack the Ripper in 1888 was perhaps one of those who was selling his victims' organs. As at least 3 of his victims had some of their organs removed. The ancient Romans developed surgical instruments and performed cataract surgeries. So now we'll move to the Middle Ages. The Byzantine Empire, from 400 AD to about 1453 AD, that includes modern-day Turkey, and Constantinople was its capital, which is now known as Istanbul. These people were actually Muslims, and they built on the knowledge base from the Greeks and the Romans. They fostered the Western rebirth of medicine during the Renaissance. So when Europe went into a decline around 400 AD, the Byzantines saved a lot of this records, and they really kind of increased it so that when the Renaissance came, the Europe pulled out of the Middle Ages, this base was still preserved. The first known anatomy book was recorded in about 1816 by Mondino de Luzzi. And interestingly enough, the first recorded separation of conjoined twins was in the 10th century in Constantinople. That procedure was not to be tried again until 1689 in Germany. So you can see the picture of the conjoined twins. Thank goodness my twins weren't conjoined, because that would have been a real mess. In Europe, the practice of medicine again went into a steep decline around 400 AD and really didn't recover until the 12th century. So about 800 years elapsed there that really nothing happened in Europe, also known as the West. And again, it was thanks in part to the Byzantine Empire that saved the ancient knowledge and built on it. Finally, students after this age were allowed to dissect the human body. And again, the first anatomy book was republished in about 1316 by Mondino de Luzzi in Bologna, Italy. He also described closing an abdominal wound. And how did he do that? Not with sutures, not with staples. He used the heads and pincers, the jaw parts of large ants. That's how he would close a wound. The first medical schools were then opened in about the 9th century, most notably in Salerno, Italy. In the 12th century, schools were founded in France, Italy, and England. Now these, again, are not schools like we knew them. These were like, more of apprenticeships and the knowledge base that had been preserved over the years. And they still weren't using the germ theory. They were still using a lot of the humorisms back then. The Renaissance then began in the 16th to 18th century. It brought an effort to translate the ancient works into Latin, and finally became experts in what had come before them. They finally caught up. Therefore, the Europeans could build on the knowledge, expanded the field of dissection of the body and body examination, other aspects of medicine. This then opened up a large renaissance for medicine, and neurology actually began in the 16th century in France and Italy. It detailed the anatomy of the brain and nerves. That's what neurology is. William Harvey in 1628 described the circulation of blood fairly accurately, interestingly enough. He was pretty accurate. The microscope was invented in 1676 by Leeuwenhoek. He was Dutch. That's why he's got such a weird name. So then the medical schools sprang up across Europe. Most were small. Again, these were kind of apprenticeships more than anything. They were pretty much all small except for the one in Edinburgh, Scotland, which had 11,000 alumni. The vast majority of people in the world, though, still had limited access to trained physicians and relied on local amateurs, again, with no professional training, but has had reputation as healers. I want to digress a little bit into some of the forms of treatment that were offered at the time. These included bloodletting, maggots, leeches. We already talked a little bit about trepanning or trephination, where they drilled holes in the skull. The effective drugs that they had at the time were pretty much limited to opium, quinine, and alcohol. Let's first delve into a little bit in bloodletting. Bloodletting was thought to allow the humors, again, we were in the humorism type of theories at the time, But this then allowed the humors to get into proper balance. Too much of the blood component, in other words. This was done by cutting and allowing the blood to flow freely, and depending on the practitioner's assessment of the situation, how much blood was allowed to flow out. It was also done with leeches. They would put leeches on you and allow so much blood to be sucked out. This practice was very, very common and lasted over 2,000 years, not ending for good until the 19th century, the 1800s. And even today, we do bloodletting with certain specific disease entities. As you can see here from the picture, there's a picture of a patient being incised there and allowed to bleed out. The Egyptians also practiced similar things like that with bloodletting, and they were thought to have come from observing the hippopotamus, whose sweat was mistakenly, their sweat is red, and it was mistaken for blood, and that animal would scratch itself to relieve distress, they thought, when actually it was sweating the red sweat. Galen, Roman physician again, he created a complex system of how much blood should be let out based on the patient's age, health, season, weather, and the place. It was kind of a do-it-yourself guide to bloodletting. He also determined which veins should be opened, depending on his assessment of the organ affected. For example, a right hand would be for liver problems, the left hand for spleen issues. The more severe the disease, the more blood would have to be removed. If you had a fever, look out, because you had to have a lot of blood let out, or copious amounts. Even after the germ theory of disease was taking hold, bloodletting was still performed by barber surgeons. In fact, today, the red and white striped poles outside barbershops symbolize these practitioners, with the red symbolizing the blood and the white symbolizing bandages, as you can see from those pictures there. And even Daryl Smith down there was a barber surgeon. Hopefully nobody has the name of Daryl Smith here. When the patient fainted from lack of blood, that was considered a good thing. That means he had a lot of blood let out, and he was going to do well if he fainted. And in fact, there is a story that George Washington was reportedly asked to be bled after he was diagnosed with a peritonsillar abscess, which is an abscess in your tonsils up here. It was also known as quinsy at the time. And within a 10-hour period, he had a total of 3 3/4 liters of blood was withdrawn from him, which inadvertently led to his death in 1799. The next slide. This is a little story here I wanted to read and share with you of a typical course of medical treatment. This example began in the morning of July 13th, 1824. A French sergeant was stabbed through the chest while engaging in single combat, and within minutes he fainted from loss of blood. Arriving at the local hospital, he was immediately bled 20 ounces, 570 cc's, to prevent inflammation. During the night, he also was bled another 24 ounces, 680 cc's or milliliters. Early the next morning, the chief surgeon bled the patient another 10 ounces. During the next 14 hours, he was bled 5 more times. Medical attendants thus intentionally removed more than half of the patient's normal blood supply, in addition to the initial blood loss which caused the sergeant to faint. Bleedings continued over the next several days. By the 29th of July, 16 days later, the wound had become inflamed. The physician then applied 32 leeches to the most sensitive part of the wound. Over the next 3 days, there were more bleedings and a total of 40 more leeches. Sergeant recovered miraculously. He was discharged on October 3rd. His physician wrote that by the large quantity of blood loss amounting to 170 ounces, nearly 11 pints, 4.8 liters, besides that drawn by the application of leeches, perhaps another 2 pints, the life of the patient was preserved. I think the patient was just really lucky. By the 19th century standards, 13 pints of blood taken over the space of a month was a large but not exceptional quantity. The medical literature of the time contains many similar accounts, some successful, some not. The other thing was leeches. Again, we just talked about leeches draining this sargent. These became really popular in the early 19th century. In the 1840s, France imported about 40 million leeches a year for medical purposes. In the next decade, England imported 6 million leeches from a year from France alone. They would apply several leeches to specific areas of the skin in order to initiate blood flow or to deplete blood from a localized area of this body. And indeed, we use leeches today. If you have a finger or a digit that has become detached, in many times we can put the bone back, the skin back, the muscles back, and the arteries back, but we can't necessarily fix the veins. And because the arteries pump the blood into the digit, we have to have some way of getting that blood back out, and that requires the use of leeches to suck the blood out. Another thing, what?
We're gonna stop there because we're up on time, so you'll have to continue